sitting there just absorbing everything. We want a good interactive day. So that's what I'm going to ask you to be doing today. It's a very significant day. We've been working on the HEF, and I say we. I've not done that much, but my colleagues here have done a great deal. I've tried my best to support them. And I'm going to tell you a little bit about where I think we are as far as the health and quality framework is. But before I do that, I just want to say, first of all, welcome. It's so nice to see so many people in the middle of December. And being it's the middle of December, I thought I'd just share a few reflections with you on what the year has been like for me. And to be honest, it's been a very exciting year. It's been a very exciting year for people with learning disabilities, their carers, and for professional staff who look after them, and particularly nurses. And I say that because I'm currently working on the one-year-on report for strengthening recruitment, which, as you know, is our strategy for learning disability nurses. And going through the report, there are 17 recommendations in it. And I have to say, we've made progress in practically every recommendation. So this year, for me, is sort of peppered with conferences, events, leadership programs, the launch of various documents. And if you think of it, and all of that really is in the middle of dealing with the fallout from Winterbourne View. And that's quite a chunky piece of work as well, as I'm sure you'll all appreciate. So for me, it's been a great year. I feel as if we've made lots of progress. I think there are lots of things that we still need to do. But the one-year-on report, I've held it back because there are a number of reports coming out between now and Christmas. I'm never sure of what that Christmas deadline is about, really, but it's the same at home, you know, everything's going to be done by Christmas, really, as if, like, the world's going to come to an end. So I've held it back. The report will be out in mid-January, and I hope you'll all get a copy and enjoy it and really see the progress that we've made. What we are going to do is we are going to publish the National Passport for people going into hospitals. Now, I know not everyone agrees with hospital passports. I know some people have already got them. But the idea of this is that, you know, if you think about inequalities, why should you have a passport if you go into one hospital and you don't have a passport if you go into another? So we've developed a national passport based on all the available evidence, best practice that we've got. And that will be available for anyone who doesn't have one and who needs one. And that's going to be coming out before Christmas. So I'm very pleased with that. So all I want to do as a result of that reflection really is to, for me, thank everyone who's either been, being able to give me their support, or give me their advice, or share their expertise with me over the last 12 months, because that has been absolutely fantastic. And it's really reassuring to know when you've got a minister asking you questions that you can pick the phone up or send an email to colleagues, and they're there and willing always to help you. And I endlessly ask for that help and advice. So from me, very much thank you all very much for that. Okay, I just want to say where I think we are with the HEF, from a sort of department's perspective, really. And one of the things as a result of Winterbourne View is that we've formed a group, a strategy group, looking at what information and data we collect with regards to what we need to help improve services for people with learning disabilities. And it's quite a tortuous group, really, because there's a lot of experts on the group, there's a lot of differences of opinion, and the overarching thing is that we mustn't give people out there in clinical services or social services extra work to do. So whereas we want to collect data continually about what's happening out there, we have to be careful that we don't overburden people with filling in forms and providing us, at the centre of the data, I suppose. And last week, Crispin was actually at the meeting and gave a presentation about the HEF. And it was received extremely, like it always is, you know, wherever guys go and talk about the HEF, everybody thinks it's a brilliant idea and we should be implementing it and getting on with it. And I'm sure at the end of the day, you will feel the same way today. But Crispin was there at the meeting, and it was really reassuring because the chair of the meeting asked us to do a presentation to the Joint Improvement Programme, which is a really step forward. And because the Joint Improvement Programme feeds into the ministerial programme, or the ministerial board. So it's a bit like, I feel as if we're one step away from blasting the minister with this fantastic bit of work. And he will say that, yes, we definitely should be rolling out this nationally. So the last thing I want to say is, I'm sure you're all familiar with the 3 outcome frameworks that we've got. We've got the NHS outcomes framework, we've got the public health outcomes framework, which Viv Bennett will talk a bit when she does her presentation, and then we've got the adult social care outcomes framework. And there are themes running through these. I have to say, I'm a big fan of the outcomes frameworks. First of all, because, you know, that whole thing about reducing premature mortality, I think what a marvellous thing to, you know, to do, to think about, to try and achieve that, to stop people dying prematurely. As health professionals and as social care professionals, I think that's an excellent, you know, thing that we need to aspire to. And then linked to that, the outcomes framework will give us transparency and show us what's happening across the country in terms of health inequalities. And I think the HEF links into those outcome frameworks really well, because the HEF is about either trying to prevent, reduce, whatever it is, health inequalities. And of course the outcomes framework are about that very thing. So the HEF gives us the actual tool to do that. And so I'm very excited about that, and looking forward to you know, how it progresses, or how we maximise it during the next sort of 12 months, I guess. So I'm going to finish now. I would just like to say, while the day is going on, I'd like you to give some thought to, if you were going to roll out the HEF across the country, how would you do that? Bearing in mind that the Department of Health can't say to people any longer, you know, you will implement this. So we have to think of ways that if we want to get our colleagues on board, if we want to get it into practice, in common, you know, everyday practice, how are we going to do that? So give some thought to that, and then give some thought to how would we evaluate it. If we implement it, if we are successful in implementing it across the country, how would we know that we are actually improving the health inequalities for people with learning disabilities? So just give a few thoughts to that.